Noeleen, delighted to welcome you to the stage and looking forward to your presentation.
Thank you, Rachel. That's a very lovely introduction. And I'm delighted to be here today talking about this research project that I have been working on for almost 4 years now. And my Professor Drennan, my boss, is here in the audience, so hopefully I do a good enough job. So first of all, what is magnet? So I'm not talking about fridge magnets or anything, I'm talking about hospitals. So during the 1980s, when faced with high turnover and poor retention rates, several US hospitals were highly successful in recruiting and retaining staff compared to other hospitals that were similar. So these were designated as magnet hospitals by the very fact and nature that they attracted staff. Magnet hospitals are characterised as a flat, decentralised organisational structure. So they give staff autonomy over making decisions by empowering their frontline staff, and leaders are capable of producing change and improvements. There's been endless amount of research on these types of hospitals in the US since the 1980s, and the environments in these hospitals have been consistently shown to have lower nurse burnout, lower intention to leave, higher job satisfaction when compared to non-magnet hospitals. They also had better patient outcomes, so better patient satisfaction, lower mortality rates, and improved safety, and fewer adverse events were reported in these hospitals. So when they looked at what characterized these different hospitals, they found 14 forces of magnetism. Now these have grown over the years to where there is now 5 magnet principles that hospitals must possess to be designated as a magnet hospital. So the first one is transformational leadership. So these are leaders who look towards the future to determine where the hospital needs to be and how they're going to get there. So it's all about enlightening the organisation on why change is needed, even in spite of pushback from staff. Then we have structural empowerment. So this is about developing, directing, and empowering staff and strengthening relationships and partnerships throughout the hospital. So it's things like staff councils, where the staff come together and decide what needs to be done, and things like professional development. Then we have exemplary professional practice. So this is strong professional practice, what it can achieve, what the role of nursing is, and the application of that role to family and patients. So an example would be developing a professional practice model, developing interpersonal relationships. Then we have new knowledge, so this is whereby they look at research and other evidence-based models, and they apply this into their organisation. The application of existing models, but also their own contribution to the science. So things like quality improvement. And then we have empirical quality results. So this is collecting outcome data and using that to further their goals. So the other 4 all underpin the empirical quality results. So as things change, then they will hopefully collect outcomes to show any sort of impact within their hospital. So then looking at magnet for Europe, so we have these magnet hospitals in the US, but these really haven't progressed over into Europe. There are 2, as far as I'm aware, magnet hospitals in Europe. So our study wants to look at if we can bring these magnet principles over and what impact that will then have. So it's a 4-year project. It's due to end the end of this year, but we are looking to extend it. And it's looking at evaluating the effect of organisational redesign guided by that magnet blueprint on nurses and doctors' mental health. So it's a waitlist cluster randomized control trial with a nested mixed methods evaluation. It's a mouthful. It involves 63 acute general hospitals in 6 European countries. We started out with 68, but 5 have since dropped out, and we're actually quite proud to say that we're the only country who hasn't had any dropouts in our hospitals. So we have 15 Irish hospitals in this project, and the other countries that are included are the UK, Belgium, Germany, Sweden, and Norway. So it really is across a wide range of Europe, and we also have the US as part of this as well. I'll come back to that later on. So as I said, Magnet for Europe uses a randomized waitlist cluster design to evaluate the effectiveness. So this just means that the cluster design is each hospital is its own cluster, so all staff are eligible to be part of this project in their hospital. The wait list is, so it was randomized into 2 groups, Group 1 and Group 2. Group 1 began the intervention earlier than Group 2, but the wait list just means that all the hospitals receive the intervention in this study rather than there being one control group, so everybody receives it. So while Magnet principles are standardized, the intervention in each hospital is tailored to their specific needs. So what they began with doing was a gap analysis, a comparison of where they were at that point in time compared to where they would need to be in order to get Magnet accreditation, to be considered a Magnet hospital. So then they used that gap analysis to tailor what they needed to do specifically, because each hospital will be different. Some of them might already be very good in transformational leadership, while others may already be very good on structural empowerment. So it was they determined themselves what it was they needed and how they were going to go about doing that. I've realised I'm going too fast. So the overall objective is to improve the mental health and well-being of nurses and doctors in European hospitals. So that's where the research element comes into it. So we measure things before, during, and after the implementation of this project. So I'm going to have some results from the baseline, which was the before section of this project, in a moment. However, this is essentially a cultural change within an organisation. So it's probably not something that is going to happen overnight, and rather going to be something over a long period of time, as it can take time to embed. So we are hoping, as we're coming to the end, that a lot of our hospitals will continue with this project, and it would be really interesting if we could come back in a few years' time and measure again where they are on their mental health and well-being. So what do I mean when I'm talking about mental health and well-being? Well, obviously we all know it can mean any number of things. So when we're talking about it in terms of this research, we're mainly talking about burnout within the hospitals. So the way we evaluate this is through surveys. And we measure burnout. We have the burnout assessment tool, and we have the Maslach burnout inventory. We also look at staff outcomes, things like sick leave and turnover, and we have also conducted focus groups. That's really to understand the context of where staff are at themselves. So burnout is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. People can feel overwhelmed, emotionally drained, unable to meet the demands of their job. They can lose interest and motivation in their work. So the prevalence of job burnout is greater in healthcare sector than in any other settings. So that has consistently come out from the research. It can range anything from 10% to 78% in nurses and 20 to 16% among doctors, depending on the study and the hospital in particular. Burnout among the healthcare workforce can result in absenteeism, poor retention rates, and job dissatisfaction. It can also lead to negative effects on patients. So you can have lower patient satisfaction, medical errors, reduced quality of care, and increased mortality. And the drivers of burnout are frequently rooted within the work environment. So it's not an individual thing. Burnout isn't considered an individual thing. Rather, it comes from the organization. So one individual in an organization with high burnout wouldn't be of too big a concern. Obviously, we don't want anyone to have burnout, but it's more when you look globally at an entire organization and you see high levels of burnout, that's when you need to become concerned. So why is this needed in Ireland? So when I'm talking about burnout, I'm mostly talking here about emotional exhaustion scale from the Maslow burnout inventory. It's one of the most frequently used scales for burnout in the research. I will say a caveat, it is not a diagnostic tool. It is an indication of risk of burnout, okay? And again, it's used at an organizational level, not a personal level. So that's why I was waiting to put that one up. So these are, this is the percentage of people who have reported experience feelings of emotional exhaustion at least once a week or more often. Things like emotional exhaustion are things like, thank you, are things like I feel fatigued, I'm at the end of my rope, I feel I'm working too hard, I feel frustrated in my job, working with people puts a strain on me. So you can see from this graph that Ireland has some of the highest levels of burnout, of risk of burnout, across this study. Now this was the baseline results, so this was before we did anything. I should also say that it was collected during a COVID lockdown and in conjunction with the cyber attack, so I don't think, yes, whereas some of them were nice, early times, pre-lockdowns and stuff like that. It was staggered, so it's not entirely comparable across all the countries. Another caveat is that Ireland, and as you can see, the UK are also quite high on this. We have 12-hour shifts. The other countries don't, with the exception of one hospital in Belgium. So that could also be a factor. It's not something I have actually analysed yet, but it's something I'm very interested in looking at. And the important thing about this is we are actually trying to do something about it. So then just looking kind of at what our data tells us. So this is some of the analysis I've done to date. It's preliminary work and none of this is published yet. So these next few graphs are all essentially going to show the same pattern, that emotional exhaustion is an important factor in a lot of these outcomes. So this shows that those that were saying the quality of care is excellent had the lowest emotional exhaustion average scores. And the inverse, those saying that the quality of care was poor had the highest. Again, this is job satisfaction. So those that were saying they were very satisfied in their job had the lowest emotional exhaustion scores, compared to those who said they were very dissatisfied had the highest emotional exhaustion scores. Again, those saying that they intended to leave their job due to dissatisfaction had higher emotional exhaustion scores than those saying that they would not leave. So a score of 27.5 there, or 0.05 on the overall, compared to 15.59. And finally, in the data, so those with lower burnout reported fewer items of missed care, as evidenced by these darker blots, so that's where they're grouped, and you can see the trend line. And for anybody interested in a bit of stats, this is actually a significant moderate strength positive correlation. So it just means that there's likely other things at play there that this isn't incorporating. So burnout seems to be a factor across all these different outcomes, but the important thing with this research project is we are trying to do something about it in implementing these magnet principles to help with this. And a very important part of our research is knowledge sharing. So in this project, no hospital is an island. So they're all progressing together, granted at different stages, they might have different goals from it, but none of them are on their own. they've supported multiple different levels. So we have our learning collaboratives, we have national country meetings where we bring all the hospitals in the project together, and we have twinning partnerships. So I'll talk about the twinning because that's a major aspect of this project just in a moment. So our learning collaboratives, these are the things that I've been organising for the last 4 years, and I have hosted 18 of these online learning collaboratives since it began. So this really is a forum for the hospitals to share their own innovative work with all the other hospitals in the project. So it's really twofold because they learn from each other, but it's also a way for them to celebrate and showcase their own work and their own things that they've been doing. So we've hosted 18 of these online. We've also had 3 in-person or hybrid learning collaboratives, and these include things like keynotes, plenaries, poster sessions, breakout sessions, panel discussions. And the very first one was held in Cork, and we were delighted to have support from our CNO at that, who opened our learning collaborative, and it was a big, big celebration. It was fantastic. And that's just a quote there from one of the hospitals on it, how it's a nice sharing and collaboration with the colleagues, and it's a nice feeling of sharing nursing strengths. So then another part of it is our national country meetings. So these are local meetings to give the hospitals the space to discuss issues and topics at country level. So these include things like timeline, methodology of study, things like that. But it also allows interaction between the country hospitals, enabling more support. And there's just another quote again. It's valuable because we all have the same challenges, and it's really helpful to hear what others are doing in practice. So, you know, they can get support from their own Irish hospital who might understand the country context compared to, say, a German hospital. And they've helped each other on things. They've gotten in contact with each other about different things. And they've said how, like, before they never would have had contact with, say, like a Cork hospital and a Dublin hospital, but now they do, which is, it's a really nice thing to see them all coming together. And then the third one, and probably one of the most important ones, is the twinning partnership. So every single European hospital in this project has a US twin. So they were matched on things like bed size and speciality, and they came together. So all hospitals were successfully twinned. They meet kind of on average every fortnight or monthly. They've also done site visits. So the US hospital will come over to Europe and vice versa. And I've gone into hospitals when a site visit is on here, and honestly, it's just this amazing atmosphere. It's this excitement and hunger for change. And the American attitude and its positivity just sort of seeps through the whole organisation. So it's really, really important part of it, and it'd be lovely to keep that support up. And I've asked many of our hospitals that are planning to continue their twinning partnership, which is so nice to see. I had asked them for some quotes on what they thought of their twinning partnership, because really this is their work. I'm just kind of showcasing it. And I just love that bottom quote: a working relationship that is no work to maintain. Oh, sorry, I was on the wrong slide. These are just some of the hospitals that are twinned. These are all our Irish hospitals that are twinned with the US hospitals. I'm not going to go through them. So what have our hospitals done so far? They've done endless amount of stuff. I'm not going to go through all of these, but it's just to showcase what has actually changed. So things like developing magnet merchandising, I can't see, mental health and staff well-being feedback sessions, developing professional practice models, development of RGN councils, quality improvement initiatives that are frontline staff-led, acknowledging and increasing awareness of nursing. Anyway, there's so many things, and I'm running out of time. So how do we ensure progress and build on interventions? So one of the major things we do in this is we communicate the results back to key stakeholders, clinicians and policymakers, such as the Department of Health. We're currently conducting the final Magnet for Europe survey and the gap analysis to determine the impact of the intervention. We're hoping they will continue the twinning relationships long term, and a lot of our hospitals have indicated that they do intend to do such a thing. Hospitals can apply for Magnet or Pathway to Excellence accreditation. So Magnet they're very similar, but Magnet is more a driver about positive practice environments, whereas Pathway to Excellence emphasises the engagement and empowerment of staff. Other things hospitals can do, any hospital can do a gap analysis. It doesn't have to be a Magnet gap analysis. It can simply be a gap analysis of where they are now and where they want to be. Important aspect of that is always to have an action plan, so also how you're going to get there. Something we did not do, because we wanted to be able to compare results across all of Europe, is we didn't include healthcare workers in our surveys outside of nurses and doctors, but I do think that's an important thing, that if any hospital was attempting to improve things like their mental health and that in their hospital, they should do. And staff engagement, so asking staff for suggestions on how they can improve things. So instead of deciding what you're going to do to improve things, asking them what they need. And this is actually something we did in our Magnet for Europe study. We asked staff, we gave them a list of items, asked them to rate their top 3 things on what they thought was the most important for improving mental health and well-being. The top things that come out for nurses are improving nurse staffing levels, adequate fixed staffing ratios, and reduced clinical documentation of burden. For doctors, it's improved doctor levels, improved nurse levels, and reduced bureaucracy and red tape. They don't want resilience training. They don't want meditation and reflection things. They don't want those. That's not going to improve things. So that's it, really. So I just want to say that acknowledge that this has been funded by the European Union Horizons 2020 Research and Innovation Programme, and we have a website and a Twitter, X page also, for anybody who wants to find out more information. Thank you very much.